Welcome to Connecticut's Health Report. Episode 5, Centering Women's Health, with Connecticut Department of Public Health Commissioner, Dr. Manisha Jitani. Because being informed is the first step to being protected.
Good health doesn't just happen, it's built. The last time you buckled your seatbelt, did you think about it before you did it? Or turned on the tap water and drank the water without a second thought? Or got a vaccine that protected not just you, but everyone around you? Someone fought for it, proved it worked, and put data to action. Welcome to Connecticut's Health Report. I'm your host, Brittany Schaefer, and I'm joined by Department of Public Health Commissioner Dr. Manisha Jitani and our very first special guest, Deputy Commissioner Lisa Morrissey. So first, thank you both very much for being here.
Thanks for having us.
May is Women's Health Month. It's a time to shine a light on the unique health challenges that women face, to celebrate the progress we've made here in Connecticut, and to be honest about the work that still needs to be done. Women are often the caregivers of their families and communities, tending to everyone else's health before their own. Today, we flip that script and put women's health front and center. So Connecticut consistently ranks in the top 10 states nationally for women's health and has one of the lowest maternal mortality rates in the entire country. What is Connecticut doing right, and how did we get here?
So thanks for asking that question, Brittany. And I think really what we're focusing on here is the fact that Connecticut does have world-class healthcare. And we have a population that is highly insured overall, which gives many people access to healthcare. And so what that means is that we do have, for many people, not all, but for many people, good access to prenatal care, good access to regular screenings for things like cervical cancer or breast cancer. And as it relates to maternal mortality, we have, again, first-class healthcare delivery, which means that when people present to the hospital, they end up doing well, and we are able to save people from some of the worst outcomes, like mortality. So those are the things that we're doing well, which is what has allowed us to be in those top rankings as it relates to maternal health, to women's health overall. Where we know that we have work to do is that in severe maternal morbidity, we are actually at the lower end of the pack. So what that really reflects is the fact that we do a great job when people are in crisis, when they really need interventions, when there are things going wrong. But when it's slightly before that, and we aren't just trying to save people from dying, we know that morbidity from things like maternal health, when you are pregnant, when you're about to have a baby, during those times, we need to do better. And we know that that gap is largest between different groups in our community in Connecticut, and disparities most certainly exist.
And I think talking about areas, of course, that we do need to work on, and being transparent is such an important conversation to have here and to bring to Connecticut residents for transparency, being clear. Along those lines, disparities nationally here in Connecticut, of course, remain. Black and Hispanic women in Connecticut receive less prenatal care than white women, and infant mortality rates for Black infants in Connecticut are significantly higher. What is being done to address this?
So the work of our maternal health task force has really brought a lot of this front and center. So we've acknowledged where we do have some disparities in the state. And one of the things that I know that I've really appreciated about being a part of the task force is that you're bringing together hospitals, you're bringing together doulas, women with lived experience, and a variety of healthcare providers to really start talking about what can we do differently to address a lot of these disparities.
And what does women, infants, children, along those lines, help across our state? And is the program successful here in Connecticut?
So the Women, Infants, Children program, or the WIC program, is a federally funded program which allows for 52,000 different women, infants, and children to be supported with real food supports, and even with helping learning how to breastfeed and sustain breastfeeding. We have one of the highest breastfeeding initiation rates in the country. Many of our WIC providers in the state actually were awarded recognition for that. And so that is something that we're very proud of, that we are able to support many families who are in need. And we know that when you have a young infant or child under the age of 5, that giving those supports with real food, so whether it be dairy products, whether it be whole grain products, things that really can support their nutrition early in life, proteins, these are things that are going to help get them on the right track early on. And that really also helps us address some of those disparities that do exist. So as DC Morrissey was talking about, we know that we have these disparities. We've recognized them in Connecticut. What we are trying to do as a department is to take that conversation one step forward. So first, with the task force that she talked about, bringing all those relevant groups together. But then in addition to that, we were legislatively mandated to come up with a report card to be able to have different health systems compared and be able to have a consumer look at what their options are out there. These are the kinds of things that we are doing and bringing all the different players together to the table to be able to help people know what resources are available to them. WIC is just one of them, to realize what you can do to be able to help your family get off to the right start early in life.
And helping over 50,000 women and infants, children here in Connecticut is absolutely incredible. It shows that the need is definitely there. So now to an important and personal topic for you, Lisa, routine screenings. As we mentioned, women are often busy raising families, working, taking care of others. What's your message to women who are maybe putting off screenings this year, and why is it an important topic for you?
Well, you are correct. This is one that's near and dear to my heart, and not just because I oversee this work here at the Department of Public Health, but because it touched me and my family personally last year when I was diagnosed with breast cancer. And, you know, it's interesting, after I was diagnosed with breast cancer, my two of my sisters who had been delaying getting their own mammograms, and I was on the phone and I was like, you need to go. And then call your daughters. Everyone needs to go. So, and I think you raise an important point, because I think for a lot of us, career comes first, the kids comes first, family, friends, all of our social obligations. But this is very similar to, you know, the same thing with the airplane concept, right? When the mask comes down, you put your mask on first. And it's so important to remember that you have to do the screenings. The earlier that we find out, the more options that you have available to you. So whether we're talking about doing a mammogram, or we're talking about a colorectal screening, screenings are important. They matter. We know that they save lives.
And early detection for you was really everything. So it was a regular, routine screening, and having that early detection really made all the difference.
All the difference. I mean, when we say that, just to frame out for people, that early detection actually gave me more options for treatment. It gave me more options for reconstruction. The clinical picture looks so much different because we were able to detect that early. I mean, in a matter, if I had put off that screening for months or a year, it would have been a very different clinical picture for me.
Yes, and I know so many people personally with the same story. I mean, early detection, it really does put a map out of just different options, chemo, surgery, just it paints a much better picture for people with such a difficult diagnosis. And Commissioner, I know this was impactful for you.
Yeah, I was going to say, I'm wearing my pink in support of Lisa. I mean, watching her go through that and seeing the impact of that diagnosis early, and where she was able to have many more choices because of that. And as a state, we do have a lot of breast cancer that is identified, but part of that is because people are doing those early screenings. So when I talked about being a leader in terms of women's health, part of that is because a lot of people have access. So whether you are privately insured or even as the Department of Public Health, we do mammogram screenings. We have partners in the healthcare community that help do screenings for uninsured and underinsured women. That's part of what we fund. That is so important because, again, early diagnosis, giving you your choices and those options for you and your family makes all the difference in terms of the long-term potential outcomes.
I know we're talking about Women's Health Month, but you often mention as well for men some of the cancer that they have, that there's graphs and data that tell us that these early detections and screenings have increased rates of finding these cancers, but have led to great outcomes for men as well.
Absolutely. And we'll talk about that in the month of June when we're going to have opportunities to focus on men's health as well. And, I think it's a confusing conversation for many because there is also this challenge in public health where sometimes we identify things that natural history in and of itself would not have resulted in anything bad from it. Prostate cancer is one of these topics that is confusing in that way, because just because you find it early doesn't necessarily mean that you'll do better, because there are morbidities from treatments and surgeries. And if you didn't really need that, that might not have been the way you want to go. So that's where sort of talking to your doctor and knowing what's right for you. Women have seen this and heard about it in terms of, well, what age should I get a mammogram at? That's really a conversation you need to have with your doctor, because it depends on your risk profile, and it might depend on your family history and a variety of other factors. Sometimes finding things early isn't always the only answer, but definitely we know that for the age groups that have been identified to get mammograms, that screening early does make a difference. Cervical cancer, this is something also, screening, yearly GYN appointments for pap smears. These are things young people can do to really help themselves stay on the right trajectory of health.
Exactly. And we look forward to talking about men's health next month in June. And as mentioning young people, of course, talking about women in their 40s and 50s, also very important when it comes to health and putting their health off. But menopause is an entire health journey in itself. Why are bone health and hormones so vital during this time?
I think it's really important in a Women's Health Month to think about the totality of a woman's lifespan. When you are young, you might be becoming sexually active, or maybe you just start menstruating. We know all the challenges young girls go through with going through those hormonal changes. And then for many women, there's a period of your life you're really trying not to get pregnant. And then all of a sudden that switch flips, and now you're really trying to get pregnant and going through all the hormonal changes that come with that. And then going through all this time period that we've talked about having children and raising children, and the mental health challenges that are involved that we know we need to do better in particularly Connecticut as it relates to maternal health. But it also continues through the lifespan. So when you ask the question about in your 40s and 50s, we know that this is, again, another period of time when women are going through hormonal changes yet again. It can result in things like brain fog and other things that people talk about experiencing as they're going through menopause. There are women who experience depression because of that. We know that cardiovascular health, bone health, all of these things are impacted by the changes that happen in a woman's lifespan. But we also know that hormone replacement therapy has sort of been all good and all bad, and the pendulum kinds of keeps on swinging in terms of where medicine goes with this. But I do believe that it has a role for some women. Again, an important conversation for you to have with your physician if you are going through some of these changes yourself. And I bring up this topic because I think it's important for older women to know that there's a place they can go, whether it is peers and other fellow communities or providers, and finding a provider who you feel can hear you and help you on that journey. Because as it relates to bone health, we know that our bones, muscle mass starts going down and bone mass starts going down from your 30s onwards. But certainly once you hit menopause, that is even more so a big factor. And so doing weight-bearing exercises, being cognizant of what these changes are. And we know that women can get bone density tests at an appropriate time. You should talk to your doctor about when the right time is for you. But there are women who may never have had one, or may have had a fracture and still have had no bone density test. So what I want to tell to older women is that talk about whether you should have one of these tests to know where you stand now. And if you've had a fracture, you absolutely should have a bone density test to know whether you're osteopenic or whether you have osteoporosis. Because we all want to age healthy, mobile, doing all the things we want to do in our lives. And if we don't have our mobility, that is the first thing to really impact your quality of life.
Really just proves there's no age a woman can be where you should slow down on your health. It's something to really keep track of.
Absolutely.
all the years of your life. Well, thank you so much, Commissioner Giuttani, Deputy Commissioner Morrissey, for sharing those very important messages with us. To the women tuning in, please, your health matters. Schedule that appointment. Ask for support. You are worth it. I have a 5-month-old son, and I've put off my annual doctor and dentist appointments. I scheduled both this month to celebrate Women's Health Month, so do that along with me. Now, stay tuned for our next episode where we'll be chatting with Gen Z about the importance of taking care of their health at a young age. Until next time, this is Connecticut's Health Report.
Thanks for joining us. Catch the full video on YouTube and stay connected with us on social media for the latest on health in CT. See you next episode.